Hello. My name is Sean Templemore-Finlayson, and I am the business team lead for Team Emma. This semester, we've been tasked with creating an application that helps doctors communicate with pediatric patients that suffer from gastrointestinal illnesses and diseases. So last semester, I came in and they told me, you're going to lead a team. And it was terrifying. And then they told me, and watch this, they're going to become more like you as you spend more time with them. And that was even worse. And so, but what they didn't tell me was how much I would learn from my interns. So I learned a lot, not the least of which was fortune favors the bold. So my team is very passionate. And as a consequence of that, there were a lot of firsts and a lot of adventures we went through. One of which was we had the first CCW cooking party, which ended with a crock pot of boiled rice. Then we actually tried to find a sponsor for our new application, Emma, and reached out to Emma Watson, who didn't reply. But their passion also led to a lot of hard work. They contacted over 300 people to find the data we found, with over 120 full-length interviews. And they put in a lot of hours, so I rounded it up to a big number. But not only have I learned from them, but I've learned how much the OU community puts into CCW. We were lucky enough to not have one mentor, but many. We had three inventors, actually, Dr. Gruno, Dr. Tung, and Dr. Jacobs, all of whom have been fantastic to work with. Along with that, we had 4 more mentors, which were, let's see, we're going to go through all of them. We had, Patrick was our fellow, and then along with that, we also had Andrew Pollock helping us. With him, we had Jim Bratton taking us through a lot of the commercialization strategies. And through all of their help, we were able to arrive at a solution that we truly believe will be impactful. On that note, I'll hand it over to Master Dev Brian, who can tell you more about the dev team and their contributions.
Thanks, Sean. All right, so at the start of this semester, I knew I was going to have a talented team, but they continually surprised me with their creativity and their determination. So as we know, CCW is all about numbers. So we have some numbers for you. Over 30,500 lines of code committed just this semester. And our talented graphic designer, Sarah Whitney, made over 5,700 unique illustrations. And we've also consumed over 400 slices of pizza, which is a lot. So without further ado, please welcome Soba.
Imagine Sammy, a 14-year-old girl with ulcerative colitis, a chronic gastrointestinal disorder. She's feeling a little nervous today going into the doctor's office as she finds her way to a seat in the waiting room. Her mom walks up and hands her an iPad with this game on it that keeps asking her questions about her disease. Except this time it's different. It's not a doctor coming in going through a checklist. It's a game that's making this whole thing a lot more fun and a lot less stressful than she remembers. She smiles and relaxes as the points quickly add up as the game progresses forward. After a semester of research, we understand that this application, Emma, needs to stay within the pediatric gastrointestinal field by licensing with insurance companies to produce over $380,000 for OU's Office of Technology Development. Hi, I'm Andrew Moore, a senior psychology major from Tulsa, Oklahoma.
Hello, I'm Bailey Hollingsworth. I'm a computer science sophomore from Claremore, Oklahoma.
Hi, I'm Sarah Whitney, a visual communications major from Tulsa, Oklahoma.
Hi, I'm Rajitha Garimella, a senior economics major from Norman, Oklahoma.
Hi, I'm Suparsha Parikh, a senior chemical engineering major from Durant, Oklahoma.
Together with our 2 inventors, Dr. Jean Tung and Dr. John Greneau, our 4 mentors, Tom Wavering, Jeff Meering, Andrew Pollock, and Jim Bratton, along with our wonderful fellow Patrick Richardson, we have developed an application that allows doctors to help improve their patients' lives. Pediatric gastrointestinal patients that do not understand their own disorder lead to an overall decrease in the quality of care, as well as an increase in the amount of cost associated with their disorder. Because gastrointestinal disorders are complex, many patients have a hard time understanding the symptoms and medications associated with their disease. Of those polled, over 40% of pediatric patients misunderstood their diagnosis before even exiting the doctor's office. This misunderstanding leads to a failure in self-care in terms of hospitalizations as well as a misuse of medications. From the doctor's perspective, it's hard to pinpoint exactly where these gaps in knowledge occur that lead to these failures, which inevitably ends with wasting of time and money by both the patient and the doctor. This is where Emma comes in. Emma is a gamified quiz application that tests patients' knowledge on their specific disease to give doctors the information that they need to tailor education. This semester, we've created a layered application starting with a quiz, supported with over 185 data-backed questions from OU Health Science Center as well as the Mayo Clinic. On top of this, we've been able to add a layer of gamification to improve engagement across pediatric patients. Through a combination of these two factors, we've been able to produce the information that doctors need to tailor individual education better. A specific example of how Emma is able to improve care is as follows. First, the Emma application tests the patient's knowledge of when they need to take their specific medications. If the question is answered incorrectly, then the patient or then the doctor is able to go in and educate the patient in this weak area. This acts as an intervention before the patient leaves the doctor's office and has to take care of their medications independently. To quantify this, we have interviewed industry experts and found that Emma estimates a 3,000 patient reduction in hospitalizations each year, totaling $15 million in savings in pediatric gastrointestinal diseases alone. Now that I've told you a little bit about the problem that Emma is looking to uniquely solve, let me pass it over to Bailey to talk about the technical developments of the Emma application.
Thank you, Andrew. So now that you've heard a little bit about what Emma is and what it will do, allow me to show you with a live demo. Due to technical difficulties, we'll go ahead with the video demo that we have created just in case that this happened. So as you can see the screen here, this is at the phase of the application where the secretary or the individual will be handling the application. They can access the settings and are able to view the questions that will be asked to the patient. They can customize the patient's data and are able to view the settings and customize the application as they see fit. When they click Get Started, they can enter an existing patient's ID to pull up their former information, or by using our intuitive interfaces, can create a new patient. From here on, the application is then passed on to the patient, to the child, and begins the child phase of Emma. You can see that an intro screen is displayed that sets the theme and the background for the game. We see the child is provided quick feedback as to what they can expect with the game, and by another simple tap, the screen will load. The patient has the ability to customize what their ship will look like by using the reward system that we have created within the game. Patients are rewarded by answering questions correctly and by also engaging with the game. They're able to choose from different types of planets that will change the types of questions that the patient will be prompted with. Upon entering the game, they will be displayed with a help screen that instructs them as to how to play the game and what to avoid and what to expect. In the count of 3 seconds, the game will begin and their score will begin accumulating. The high score is tracked over several iterations of the patient playing the game. You'll notice that by hitting the ground or by hitting any of the objects, the health of the ship will decrease. When the health of the ship finally hits 0, the question phase of the application will begin. The patient will then be able to input the answers to their questions, and upon answering a question correctly or incorrectly, will decide the type of feedback that the patient is given. Upon answering a question incorrectly, they are given feedback on the correct answer to that question. Upon answering it correctly, they are rewarded 100 gems for their effort, and this question phase continues until all of the questions have been answered. Once they have answered the number of questions that have been designated through the clinical settings in the application, the end screen is played, and this marks the end of the gaming phase of the application. The patient is displayed a results screen that shows them how they performed in the game, as well as how they performed with the questions. They have the option to take a survey, and by using these survey results, they are sent back to us, which can allow us to improve the game through several iterations. This marks the end of the application for the use of the child, and is here where the iPad is handed back to the clinic, where the data can then be reviewed as to see where the child is lacking the education through the questions that they answered. And by tapping the Done button, we'll see that the information will be emailed directly to the doctor in a way that is safe and easily readable, so that the doctor is able to adjust the education and assess where the patient needs assistance with. So now that I've talked a little bit about the game and showed you how it will actually work, let's toss it over to Sarah, who will discuss the design elements that went behind Emma.
Thank you, Bailey. So Emma is implementing the essential design elements to further engage our audience while adding variety in our gameplay. Research is key in understanding what our patients would like to see implemented in our application. We have conducted a survey that had over 42 different themes that they can vote on. We are now implementing the space theme, the ice theme, desert theme, haunted theme, and also the sea theme. Furthermore, patients also wanted to see something that was more realistic. Therefore, we implemented parallax scrolling. Parallax scrolling is essentially multiple layers that come together to form one single image. This helps our levels by creating depth within our level, and also helps us control each individual layer for speed. Furthermore, we have implemented a vibrant color palette. This is to help evoke emotions and also to brand our company and show visual hierarchy. Now that I've talked to you about our essential design elements, I'm going to hand it over to Rajutha to talk about our competitors and our market.
Thank you, Sarah. Emma's unique approach to education, as well as gamification, along with its clinical backing, sets it apart from its competitors. After over 125 industry interviews and research into the competitors, we have established 4 key metrics for our application. The first of which is educational assessment. The physician receives educational information from the patient about the knowledge gaps in which the patient has. What sets Emma apart is the fact that our educational assessment has questions with clinically backed research from Mayo Clinic and OU Health Sciences Center. The second metric that we have is gamification. Integrated gameplay provides for a more engaging experience for the audience. Emma's target market is pediatric patients, and we have found that children are the most difficult to engage and the most difficult to receive information from. The third metric that we have established is multi-platform integration. This is when EMR as well as REDCap provides for a more seamless display of information from physician to the patient or patient to physician. Currently, Emma utilizes PDF and CSV formats to provide information to the physicians. Traditionally, this is a format that is used by many mobile health applications. In the future, we will be integrated with electronic medical record systems to provide for a more seamless transfer of information and provide us with a more competitive edge in this market. The fourth metric that we have is clinical research. Through a previous iteration of this application at Mayo Clinic and OU Health Sciences Center, we have established a set of data-backed questions. And through continued research at both of these institutions, we will be in the top quartile of mobile health applications. Through this, we will be able to expand into other markets. Emma has the potential to reduce hospitalizations for the 160,000 patients with inflammatory bowel disease. Within this market, there are 18 million children with a chronic health illness. In this market lies diabetes and asthma, 2 of the most prominent diseases. However, we have found that these markets are already flooded with technologies for education and management. The inflammatory bowel disease market has 160,000 patients. We have found that 1 in 10 of patients diagnosed with IBD every single year are children, and about 20% of those diagnosed with inflammatory bowel disease were diagnosed prior to the age of 20 years old. Breaking down these numbers a little bit further, we have found that $17,000 is spent per patient per year for treatment of inflammatory bowel disease. And of the 160,000 patients with IBD, 30% are hospitalized every single year. With our licensing strategies, we will bring down the cost of hospitalizations by $15.2 million every single year. Further providing the unique approach of Emma and the small market that we are currently targeting, we have clinical research to back the question set that Emma establishes. Further, this has provided a unique proof of concept so that we can move forward and expand into mental health markets, as it has been a promising avenue through industry interviews with physicians, patients, as well as research into various journal studies. So now that I've given you information about the competitors and the market that we have approached, let me hand it over to Suparshva so he can give you some information about the business strategies and the next steps we will be implementing.
Thank you, Rajitha. Emma must partner with insurance companies to reach the market with significant impact and revenue. Insurance companies provide a threefold benefit. First, through insurance companies, we have determined that based on industry interviews with healthcare experts, insurance companies have the most incentive to adopt Emma, based on their ability to generate significant cost savings. Second, insurance companies are able to generate a large patient population for Emma through a pediatric GI population of over 30,000 patients. Third, insurance companies allow Emma to reach physicians without cost to the physicians. Now that we have considered these three benefits, we have determined that insurance companies are the key potential partner for Emma to move into the commercial phase. With that, let's take a look at exactly how this partnership plans out. First, the Office of Technology Development provides the application through a license to insurance companies. Insurance companies, such as United Healthcare or Aetna, then provide the application to their physician network of providers. These pediatric GI physicians then provide the application to their patients. Once patients have gone through several iterations of the application, they are able to generate improved education. This improved education will lead to lower and fewer hospitalizations. Each avoided hospitalization will lead to $5,000 in reduction in cost for the insurance company. Based on the OTD licensing model, OTD will be able to generate revenue based on the cost savings that an insurance company generates. With insurance companies' ability to help Emma reach its projected financial and social impact, we have determined that OTD will gain substantially from marketing Emma and commercializing with an insurance company. OTD allows Emma to gain over $387,000 in revenue over 5 years by partnering with a large insurance company. Emma has a 7-year rollout plan. In the first 2 years, Emma will go through research and development. In the research and development phase, any app development costs that will be incurred by Mayo Clinic or OUHSC will be covered by a research grant similar to the R01 grant covered in phase 1 of research, or through an insurance-based pilot study grant provided by an insurance partner. Once Emma has gone through this commercial phase, Emma will roll out over 5 years with increased reduction in hospitalizations each year. Our physician interviews have determined that in the first year, Emma will have a 5% reduction in hospitalizations based on its ability to reach a limited number of patients. As more patients adopt the application and go through more sessions with the application, in year 5, Emma will have a 20% reduction in hospitalizations. Over the course of 5 years, each year, a 10% reduction in hospitalizations will be averaged. With this average, insurance companies will save $1.32 million in cost savings through reduction in hospitalizations. Over that same 5-year span, the Office of Technology Development will be able to earn over $387,000 in revenue based on its cost savings model of licensing to insurance companies. For Emma to have this social and financial impact, it needs to go through a series of key steps before it is commercialized. Emma should license to insurance companies in 2019 after it has gone through a research phase through Mayo Clinic and OUHSC and identified a key insurance partner. First, Emma needs to establish its validity, so it needs to go through a round of research that proves its concept and demonstrates its commercial effectiveness. Then, Emma will smoothly transition from research to the commercialization phase. On the gameplay side, Emma needs to focus on developing continued gameplay developments so it stays an engaging application. Also, the new development team needs to be able to develop a method to integrate EMR systems and REDCap-based research systems into Emma's portfolio so it can continue to commercialize. Once these steps have been implemented, Emma is primed to move to the commercial market. Emma is uniquely poised to have a significant social and financial impact in the GI market. Emma's unique gamification model, as well as the clinical research that supports it, allow it to have a significant impact on patient wellness. Through this gamified education model, Emma will reduce hospitalizations by over 3,000 pediatric GI hospitalizations each year. With those hospitalization reductions, Emma will be able to generate $1.32 million in cost savings for insurance companies and over $387,000 in revenue for OTD. With that, we really hope that we have a significant impact with Emma's continued development and research moving forward. And we now thank you all for coming here and open the floor for questions. Yes, sir.
So you said that the question prompt is tied to losing health. Is there a situation where health can be so good that they avoid these altogether, or is like failure of heart or random injury?
So the question asked is essentially what stops a player who is very good to just continue the game endlessly. And this was a struggle that we looked to when we were designing the game, because we wanted to design a game in which the player was able to be rewarded for playing well, but also we wanted to limit the amount of time and utilize the time in the waiting room effectively. The game scales linearly in difficulty for the length of the time that the game goes on. As the game goes further, as the game progresses on and the player continues to play the game, it will become progressively harder in the fact that the ship begins to move faster and more objects will begin to spawn, so it becomes increasingly less likely for the player to dodge it. So in a sense, there is a soft cap on how far the player can make it through the game. However, they are able to make it far enough and that it is still rewarding and engaging for the player.
Yes, ma'am.
So the question was, what is our target market for a game? So Mayo Clinic is currently testing ages 9 through 14, but we are currently looking at other ages as well.
How much time do you estimate you add or subtract from the typical hospital visit?
So the hospital waiting time will not increase at all because the application will be used within the waiting room. So whatever time is currently used in the waiting room as idle time will be translated into patient utilization of the app. Yes, sir.
That's a small question. First, I think actually you contacted health insurance providers. And second of all, have you looked into actually the cost of adapting to your app? I mean, using the app to do your app, but now bringing the app to my clinic would say I'll potentially have to buy two of these adapters, maybe even a trainer to use it. Have you got a look into that?
Sure. So the questions asked were first, have we actually contacted any insurance companies that identify models to commercialize? And the second question was, what exactly would the cost be for clinics? So to answer your first question, we have contacted medical directors at both Aetna and United Healthcare, and they have said that they were interested in the application once it has gone through the second round of research. So the first round of research demonstrated the question set and what needs to be done to improve the application, and the insurance companies we have contacted are interested in the app that will be developed based on the improved validity of the application with the new research that demonstrates how it reduces hospitalizations. And for your second question, which was what exactly is the cost for the clinic? So based on the physician interviews we've conducted, if the app is able to generate significant cost savings, they are willing to take the cost upon themselves for the iPad that they would have to purchase because the insurance companies would be providing them the application free of cost, so they wouldn't have a subscription to the app that they would be concerned with over several years. Yes?
How did you determine that this would reduce hospitalizations by that amount? Because you talked about pediatric patients, so I'm assuming 9, 14-year-olds aren't really completely in charge of when they take their medication and necessarily need to know those kind of details. So how would an educational app for children about their disease actually reduce those hospitalizations?
So that's actually a great question. So the question that was asked was how exactly will our app reduce hospitalizations and how did we come to the figure of hospitalizations we will reduce. So the figure we established was based on two metrics. The first is that Boston University has identified that hospitalizations that are preventable are 30% of the total hospitalizations, and oftentimes they can be remedied by improved education. And based on our physician interviews, specifically with division chiefs at Tennessee and Wisconsin, we have been able to identify that the approximate reduction in hospitalizations will be 10 to 20% based on the number of people that would be compliant and the number of patients that would be able to be affected. So the way this would work is that the patients would be provided the education, but for 9 to 14-year-olds, commonly the parents are also in the room. So the parents would also be part of the compliance sort of equation, and they would help make sure that the new education that the patients have learned will be integrated into how they carry about their daily lives. So we have time for one more question. Yes, sir.
So who would own the data or like the information they have on patients? Would the insurance company own it? If I transfer doctors, would I be able to like exploit it or keep it or anything like that?
So the question asked is, who owns the data that is stored on the application about the patients? First of all, it's important to note that the data that is stored by the patients is de-identified. There is no way to know which patient is which, to tag them with a name, unless you are the doctor who has access to that ID from your internal system. Secondly, this data that is stored is not essentially owned by anybody. It is simply used by the application. Currently, there is no method of transferring entire sets of data to a different clinic. However, there is the ability to transfer the iPad as each patient can be tagged with different clinic IDs to know where the patients come from. This functionality could be added in the future, and this may be something that we include in our future write-up before we pass on this application. But currently, no, there is no feature that does that. However, that is 100% possible.